अस्सलाम वालेकुम व्यूवर्स। आई होप आप लोग सब ठीक हैं। हमारा ये टॉपिक है आज टेटनस का। बायोलॉजिकल टाइप की वीडियो है। उसका disease है tetanus. Tetanus is an illness characterized by an acute onset of hypertonia, painful muscular contractions. Despite widespread immunizations of infants and children in the United States since the 1940s, tetanus still occurs in the United States. डिस्ट्रीब्यूशन ये चार्ट कहाँ कहाँ टेटनस फैला गया दिसंबर 2002 में। कास्ट ऑफ कॉन्स्ट्रेडियम टेटानी ग्राम पॉजिटिव परफॉर्मिंग एनारोबिक बेसिली causative agents clostridium tetani. Morphology physiological relatively large gram positive rod shaped bacteria spore forming anaerobic found in soil, especially heavily manured soils, and in the intestinal tracts and feces of various animals, strictly fermentative mode of metabolism. Methods of transmissions. This is some points of methods of transmission. Transmission may follow burns, deep punctures, wounds, ear or tension, infections, animal bites, absorption. Methods of transmission. Tetanus may follow burns, deep punctures, wounds, ear of dentition, infection, animal bite, absorption. Only the growing bacteria can produce the toxin. C. tetani entry for spores. Entry of C. tetani into the body usually involves implantation of spores into a wound. After gaining entry, C. tetani spores can persist in the body for months, waiting for the proper low oxygen growth condition to develop. Virulence, pathogenicity, not pathogenic to humans and animals by invasive infection, but by the production of potent protein टॉक्सिन सी टेनिया है यहाँ पे ये डिस्कस किया स्लाइड में. टेटनस टॉक्सिन प्रोड्यूस व्हेन स्पोर्स germinate and vegetative cells grow after gaining access to wounds. The organism's multiple locally symptoms appear remote from the infection sites. One of three most poisonous substances known as weight bases. The other two being the toxin of botulism and diphtheria. ये tetanus toxin है. इस चार्ट है toxic symptoms. There is some symptoms: tetany, seizures, painful power, burst of muscles contraction. If the muscle spasms affect the larynx or chest wall, they may cause asphyxiation, stiffness of jaw, stiffness of abdominal and back muscle, contraction of facial muscles, fast pulse, severe sweating. Patient manifest with this one is baby has national tetanus with complete rigidity. Types of tetanus is local, cephalic, generalization, mutational, local tetanus, and cephalic tetanus. Most common types is generalized tetanus, neonatal tetanus. Methods of diagnosis based on the patient account and physical finding data characteristics of the disease. Diagnostic studies generally are the little value as cultures of the wound sites are negative or for C. tetani 2/3 of the time. When the culture is positive, it confirms the diagnosis of tetanus. Biochemical reactions will characterize the C. tetani. Diagnosis is tests that may be performed include the following. Culture of the wound site may be negative even if tetanus is present. Tetanus antibody test. Clinical treatment: if treatment is not sought early, the disease is often fatal. The bacteria are killed with antibiotics such as penicillin or tetracycline. Further toxin production is thus prevented. This is the method. Other supporting measures: specific treatment, tetanus toxide, active passive immunization, prognosis infected, cure in the hospital to eliminate C. tetani spores. This tetanus is a vaccine preventable disease. Do vaccinate without fail. वैक्सीन्स की। ये हमारा आज टॉपिक जो था, वीडियो बनी थी उस पर टेटनस पे। आई होप यू लाइक दिस वीडियो। खुदा हाफिज़।